Thank you very much, Honourable Minister for Information. Honourable Ministers, hearing at ladies and gentlemen of the press, I think I'm quite happy to join you here. In all this challenge, one of the key things is staff protection. Because apart from this challenge we are having to deal with cases that already have been there. Pregnant women will be there, people will be sick, malaria will be there. So two key things that we are taking care of is first is to staff protection, and secondly, to expand our capacity to be able to respond to the current challenge. As I mentioned last week, one of the things we are doing is we advise all health workers and facility managers to ensure triaging at the outpatients. So there's a pre-triaging where cases are selected to ensure that all respiratory cases are isolated and people are designated who see them, so that we do not only protect but also protect other patients who have come to the outpatients for care. To do that, PPEs have been provided. Currently, we have done more than 10,000 PPEs distributed. We are going to ramp it up to about 50,000 within a short time. And when we talk about PPEs, there is a package of a set. There are some that are needed more. And so some of them, for example, we have over 3,000 coveralls, which is the one that you see wearing people all over the place. You have the N95, which is a very highly, that spills out all kinds of, up to 95% of all debris and all viruses. But that's called an N95. We have more than 2,900 developed, distributed and more. We distributed goggles, we have face shields distributed, boots, among others, and we have more than 100,000 gloves of different shapes distributed. We are also ensuring that to build our capacity, all our staff who are currently on steady leave have been called back to come and join the force until the schools are open, so to keep our support. And we also know that retirees have been asked to come back, and doctors who are awaiting their financial clearance are also being asked to be recruited to participate in this exercise. The Honourable Minister, the Minister of Health, has procured more beds to expand our capacity, bed mattresses, to look at that. We also have the training response team are trained across the whole region, and all regions are doing downstream training, including ambulance service staff and other people. Regions have identified treatment sites, because this means in Accra and Kumasi, and so all regions have beds allocated. Should we have a case, this is where we have. Currently, we have about 545 beds allocated across the country, and it's expected that more will be identified. And as we get into the situation, we need more. The facilities will be asked to look at more. We may also look at other opportunities to create space to manage the cases. The treatment protocols has been asked. I can't take you through all that, but the most important thing, as happened over the world, is the fact that when you have these conditions, please call. When you have cough, fever, etc., that has of respiratory nature, don't get into a taxi and go. Just call the numbers there. Now the 112 is working. Somebody will get back to you and make sure they will direct you as to how you seek care. Either they come to you. So we don't want a situation where everybody's rushing to the facility. And in the process of getting there, you are distributing the cases. Mr. Minister, that's all I want to add. Thank you very much. Yes, we've also distributed more than, you see, I would say 10,000 sanitizers, but what you know is that facilities and hospitals are procuring a lot on their own. We have also given the regions the opportunity to procure additional PPEs out of the funds that we have given to them to protect staff, so that they can identify specifically what their facility needs are as far as their service providers. But let me add that when we say frontline staff, includes the security men, outpatients, records, pharmacists, everybody who will, maybe I mentioned the pharmacists as well. Everybody who, by way, is part of the process of taking care of any patient who happen to be COVID-19. Thank you very much.